Namaskar. I'm Dr. Ashlesha Shukla, Associate Consultant Rheumatologist at Manipal Hospital Bhubaneswar. Today we'll be discussing about a common autoimmune disease. One disease is rheumatoid arthritis, which everyone is well versed with, but there is another common disease which is known as Sjogren syndrome, which people are not much aware of. Sjogren syndrome is a more common disease than rheumatoid arthritis. This disease includes involvement of all kinds of salivary and sweat glands within the body. When there is damage to these glands caused by autoimmune process formed by autoantibodies in our body, these glands will get damaged and they will cause various symptoms, which includes dryness of eyes. Patient will feel gritty sensation in eyes. They'll develop redness of eyes, which at later stage will cause diminution of vision, and it can be vision threatening also. Same way, there will be loss of salivary glands in the mouth, and it will cause dryness of mouth. There will be difficulty in swallowing, difficulty in eating food, and difficulty in deglutition. Also, there will be formation of multiple dental caries, and there will be burning sensation in mouth. These symptoms are usually ignored by the people in initial stages, but in later stage there will be complete loss of dentures also, and patients will present with dental prosthesis at later stages. Excluding these, there are other subtle symptoms of Sjogren syndrome, which includes persistence of fatigue, joint pain, joint swelling. Sometimes patient may also develop neuropathic symptoms, which includes tingling, numbness and burning sensation involving upper limb and lower limbs. Patient may also develop renal involvement in form of nephritis at later stage of the disease. They can also develop anemia and low platelet counts, anemia. All these are other features when the disease gets progressed in later stages. But initial symptoms are usually neglected, and patients generally visit ophthalmologist, dentist for all these symptoms. But when the disease is worsened and it is in the last stages, at that point of time they consult a rheumatologist. So coming to Indian context, this disease is more common in females in a ratio 9:1. Globally, this disease is more common in postmenopausal and middle-aged females, but in Indian context, different studies have been done where they have seen that this happens 10 years earlier in the Indian age group. That is around 30 to 40 years of age. This is more common in Indian setup, and this is more common in females like other autoimmune diseases. Management of this disease includes whatever patients will have, whatever symptoms will happen, we will treat accordingly. Like there is dryness of eyes, we will provide tear substitute. If there is dryness of mouth, we will treat with saliva substitutes. And if there is involvement of internal organs like lungs, peripheral nerves, renal involvement, joint involvement, or patient will have anemia or cytopenias, we will start with immunosuppressive medications. So at the end, I would like to conclude that to create awareness regarding Sjogren syndrome, every year we celebrate Sjogren syndrome day on 23rd of July. So if you are having any kind of symptoms which we have discussed, like dryness of eye, dryness of mouth, fatigue which is not improving after rest, joint pain and joint swelling, skin rashes, kidney involvement, nerve involvement or lungs involvement, or any kind of persistent low hemoglobin and anemia, you can feel free to contact a rheumatologist at Manipal Hospital Bhubaneswar.